Tim Mendino, a health administrative student from the Milken Institute School of Public Health, asks, from a public health perspective, prevention of disease is much less expensive than treating an illness or disease. What barriers prevent us from using more resources to tackle the social determinants of health that are the key means of preventing diseases? How do we overcome these barriers?
So the issue of prevention is one that I think is tremendously important, and we're at a critical place as we're thinking about changing our health delivery system to one that is less fee-based and more impact-based, because I think we know the importance that prevention plays in that, both in terms of how we'll save money and how we'll get better results. But one of the questions I think is, it is not always easy on the prevention side. And my experience through a number of experiences, whether it's at Gates or at Walmart, is when you think about prevention, the first thing is people have to have the knowledge. So let's take, for instance, healthy eating. They need to actually know what healthy eating is. They need to understand how that's defined and what that would mean eating. The second thing is they need the tools. And the tools come in various forms. Some people don't know how to fix fresh vegetables or haven't used them before. Think about if you've never really cut a pineapple, would you exactly know? Or even a pomegranate. How do you get all those seeds out? But even your day-to-day things that people may not have experienced, so tools. And tools also come in the form of affordability. So many of the things we're trying to teach communities about prevention and healthy eating, do they have access? Are they in a food desert? Even if they're not in a food desert, are they in a place where they could afford the fresh fruits and vegetables that we want to encourage as part of healthy eating? So the tools. And then the third thing is culture and behavior change. And probably if we did a little survey here, did everybody get up this morning and exercise? And did everyone eat, a serving of fruits and a low-fat, we could go through it. And I'd say most of the people in this room are good on 1 and 2. But even those of us who have those things, and so it is about behavior change. And so to get improvement, I think we all have to as a nation, and not just as the government, but as communities and individuals, we have to work against all three.
Wonderful. And you just made me feel a little bit bad because I did not work out this morning or eat my fruits this morning, unfortunately.
I hope everybody had breakfast at least.